my very first appointment was when I was diagnosed officially with my primary care doctor. He did what I asked him to do, which was to find 3 doctors in the area for me to go to. And within that amount of time, within a week, he had done that for me. I met Dr. Weiss first at a lung cancer advocacy summit after I pretty much had gone through my initial treatments here at UNC. I always feel I can ask him anything and he will be perfectly honest with me. I always worry about if he ever has to give me bad news, he's going to be very disappointed because we are close as a patient and doctor relationship.
What I'd like for all patients to know is that we're going to be a team in their care. One of the important things in maintaining that is good communication. And one of the most powerful tools to accomplish that is nothing more than a pad and paper. Cancer is very emotional. Emotional things make us forget. So bring a pad and paper, bring questions written down, feel free to write during the encounter, feel free to tape record the encounter. Tomma knew what she wanted early. She came to me, she knew her values, and she made them immediately clear to me. Tomma was an educated patient, and she was educated with quality information, not sort of joe-made-it-up-cancerblog.org. She had quality source of information and came in knowing quite a bit about her cancer. Tomma came in with a list of questions, and they were her questions, the things that mattered to her. And perhaps most importantly, Tomma had a great support system. In particular, Tomma has a wonderful, loving husband and a supportive family.
My husband is a professionally trained Santa Claus, and he is now a weekly volunteer with Pediatrics Oncology. He is the Santa Claus for the North Carolina Children's Hospital Radiothon. And he just loves what he's doing, and he would be over here all the time if he could. And it's a big change for him, and that's my gift of my cancer is what he's now doing. And I'm now a volunteer too, so yay!
I think that patients need to ask early, much earlier than they realize, if there's a promising clinical trial available to them. Clinical trials are available for specific lines of therapy. So some of our most promising stuff now, stuff that we are all convinced is going to be FDA approved within a year or two, that's going to change the face of cancer care, is only available on trial as the first treatment. And so once a patient gets that very first drop of standard chemotherapy, there's a host of promising trials that they immediately become ineligible for.
I really believe getting more than one opinion is extremely important. I got 3 opinions. I think that's important. Make sure you're comfortable where you're going. If you don't like it, keep looking. There are other options. And the other thing would be encourage molecular testing now for lung cancer patients. I just think we want people to know we have opportunities to become aware of the need for lung cancer patients so that we can fight this and be successful too. We want people to recognize that it's not a smoking disease, and it's not, we carry that stigma, however, and we don't quite know why we don't get the research money.
What does Lung Cancer Awareness Month signify to me? Well, the lung cancer ribbon is clear, or white, because we're the invisible cancer. Lung cancer is the greatest killer of both men and women nationally and internationally. To put this in perspective, a non-smoking woman has a greater chance of dying of lung cancer during her lifetime than she does of dying of breast cancer. Despite this, lung cancer is the most underfunded cancer, and I think that the lung cancer patient is among the least supported patient by our society and communities. Lung Cancer Awareness Month is an attempt to change that, to raise awareness so that we can get more funding for our patients, so that we can reduce the stigma of lung cancer and get more support both for individual patients and for broader efforts against lung cancer. And finally, and perhaps most importantly, I want patients to know early on that lung cancer is not their fault, even if they smoked.